Astonishing stats from the CDC. 33% of 12 to 17-year-olds have prediabetes. Prediabetes is not just a warning sign for type 2 diabetes, but also for other health problems like heart disease and even stroke. Joining us to talk about that and other health topics is Dr. Bill Hartman, a clinical trialist at UW Health. Doctor, why are we seeing so many teens with this pre-condition?
This is really an alarming number that 1 in 3 teens aged 12 to 17, about 8.5 million kids in the U.S. have this pre-diabetes or elevated blood sugar levels. They're not elevated enough to give them a type 2 diabetes diagnosis, but it's still a warning sign. And it happens because of kids being physically inactive or overweight or obese. And these are things that are highly modifiable at this point. Pre-diabetes, like I said, it's a risk factor for other things that are bad, but it's also a warning sign. And when you know something, you can do something about it. And so if your kids are overweight, if they're obese, if they're physically inactive, encourage them to get outside, go for a run, play a sport, change the diet, watch the foods that they're eating, and try to reverse the course of going on to a worse case of diabetes.
Wow. Okay, let's get on to Ozempic. We just keep finding more and more uses, and it now may help with migraines?
So this is a really small study that came out of Europe looking at Victoza, which is a Ozempic-like drug, one of these GLP-1 agonists. And what they saw is that after 12 weeks on Victoza, people who frequently had migraine headaches were able to reduce the number of days they had headaches by half. And so the number went from 20 days in a month down to about 10 days in a month. So it's really remarkable. It worked independent of weight loss. And so this is a totally new mechanism for GLP-1s. But it's something that we have to keep an eye on. The study's not big enough to really draw big conclusions from, but it's something that is very exciting in the world of headache.
All right, and I get a lot of them. Let's talk about the emergency room visits for ticks near record levels.
Right, mostly in the northeast part of the United States, but certainly with deer ticks here in Wisconsin, it's something that we have to keep an eye on. We are seeing an uptick in the number of tick bite visits, especially in kids under 10 and in adults over 70. And so help your kids and help your parents look to see whether or not they have ticks on their body, in their hair, on their clothes when you come in from the woods or a walk in the prairie. Lyme disease is real. It's something that you don't want to get, and the easiest way to avoid it is to make sure that you don't have ticks on your body.
Let's talk tick removal very quickly. I've never had one. Do you recommend like using a match or something on the end of the tick to get it out? Or is that just like urban myth? You know what I'm saying?
That might be more urban myth. Really, you should use tweezers to try and remove the tick as much as you can from your body. And then you physically get rid of that tick, get it out of your house. But the easiest way to do it is with the tweezers.
All right, thank you.